question back here?
Not a question, but a comment. I'm a retired physician, and what we ended up doing in our practice probably 10, 15 years ago is if a new patient called, we often couldn't see them for quite some time because we had slots held for situations like the gal who was discharged from the hospital, the cardiac condition. I was an OBGYN, so she certainly wouldn't have called my office, I hope. But if I had a post-op patient who was having a problem or thought she was having a problem, I always had a slot that I could put her in within 24 hours, or one of my partners would see her.
Well, part of it is explaining what your need is.
Exactly.
And the person that makes the appointment is not medically trained. At the most, they're a medical assistant, so they don't have the knowledge to know really how important it is. You have to balance that off.
But the office nurse. Right.
Yeah, and so yesterday I mentioned I was seen by a rheumatologist, and the guy's brilliant, but I'll be lucky if I get an appointment back with him before I go north, because there are very few rheumatologists. There are a lot of people who need that services, and he's booked. And his office was efficient. He was efficient. He was bright. He's working at just about full capacity. But I explained that if I don't get another appointment, I'll be north, and then that'll sit on my situation for 6 more months, because I live in the middle of absolutely nowhere. I mean, we have horses and buggies where I live.
I have a question.
Yes.
There was an editorial in the paper where this couple went to the doctor's office, and because of heavy traffic, they were late, and they didn't want to see them because they were late. If that couple then decided to stay in the office, did the doctor then finally have to see them?
An office doctor can make pretty much whatever rules they want, and unless the patient came to direct harm, the doctor can do whatever they want about that. It is an upsetting thing to be turned away from an office, or conversely, you're at there 10-15 minutes before the appointment, and an hour and a half later they still haven't seen you. I'm sorry, it is sort of life, and when you go to the ER or you go to a doctor's appointment, you should have your soon needed medications with you, a book, a little granola bar or snack or something, and just be prepared that it is not a trip to McDonald's, which is what we all want out of everything. We want it quick, we want it cheap, and we want it just like we thought we were going to get it. And life doesn't work out that way. And I'm dealing with my 2 elderly parents have a 5-second limit on their wishes or wants. That's the wick on their candle, 5 seconds. And I've had to get really creative. Really creative.
I have a suggestion.
Yes.
I always keep the appointment card that the nurse gives you or the receptionist gives you, and I take it with me. And we went to the doctor's office, and I see all these people going before us. And an hour later, I told the girl that, our appointment was at such and such a time, and she said, you were late. And I said, I was not late. And so I gave her my appointment card, and she looked everything up, and then she apologized that she had made an error. So I always ask for the appointment card, and I present it. That's happened to me twice.
Well, that's a great idea. I tape the appointment card to, you can use your phone for appointments, but probably most people here write stuff down. And so I have a daytimer type thing, and I tape those appointment cards in there, and I take that appointment card with me. And some offices call and confirm the appointment, and some don't. If they don't, I do, because my time's valuable too. I've got.
Sometimes they don't even have it on their books, and then
Yeah, you could get there and they'll say we don't have you, or I could tell another story. Anyway, another reason to have your little notebook is to any questions that you have while you're sitting there waiting for those labs and waiting for that X-ray or whatever it is. Well, write down your little questions, because when they come in to discharge you, boy, they want you out of there. They want that bed. And so if you're in the car and then you're like, oh, well, it's too late. So just a little spiral notebook in your purse is such a helpful thing. And then the ER is obliged to give you recommendations for help at home if you think you need it. I was exceptional in trying to consider if a person was safe for discharge or needed help at home because of my personality and because of my family situation. And I'm pretty sure I lost a job over the following. 94-year-old lady brought in for falling from in her senior building that she lived in. Lives alone, no family in town. Splits her head open, bangs up her wrist, bangs both knees. We stitch her up. Vital signs are fine. She's diabetic, but that's okay. And I notice she's not too clean and she's underweight. No family in town, and required 2 nurses to help her to the bathroom. So I call up the doctor of the day and just say, I'd like to admit Mrs. Jones for a couple of days. She's an unsafe discharge. I do not feel she would be safe to be at home, and we cannot arrange anything during the night. And furthermore, it's the weekend, so I can't even hold her in the ER and get something set up for the morning. And he called me a bad word that started with a B, and he said, if you think she needs so much care, take her to your house. Oh, wow. And that doctor is still on that staff, and I am not. Okay? Wow. But I was going to stand up for the patient no matter what it took to me, because
But you're not the norm.
I'm not the, I am unusual. I've been like that since birth. Okay.
Did she fight back?
To some degree, but the ER doctor is, despite the publicity of emergency medicine, no ER doctor will ever have the power in a hospital that the cardiologist and the surgeon will. Ever. Ever. Anyway.
Pardon me for interrupting. The hospitalist role, I'm encountering that.
Okay.
Can you
Yeah.
profile
Okay.
that or
Hospitalists.
place them in the rank?
Hospitalists are doctors who are assigned on call to process admitted patients who they will likely not ever know. And some of them are better than others, but basically they just want to crank you through, get you in that bed, and get you out of that bed as soon as possible, often with very little emotion and many times with a language barrier or some other stuff going on. And that's why having an alert family member, or maybe, let's say, your middle-aged daughter come and help you get through this situation could really help you a lot. And you're going to see more and more of hospitalists, more and more and more. Yeah.
Yes, on my med list, I also put an emergency number, put my son on there, with his telephone number and so on and so forth.
Yes, sir, I did mention that. Yes, sir. For traveling, yes.
I'm sorry, you've talked a lot about language barriers. Are you suggesting that we're having doctors or hospitals who don't speak English?
Both doctors and nurses whose command of English is either possibly somewhat limited, or let's say you take somebody who's 75, 85, and they're the patient, and I don't want to say any one country or the other, and the person's from some foreign country with a thick accent. Do you think the communication is going to be as clear as if they were talking to you and me? It's
They're folks from the South I can barely understand, though.
yeah. We have a bunch of Haitian CNAs working for us in the home, and my mother has actually perfect hearing for somebody who's 91, and it drives her crazy because they don't understand her properly, and she can't understand them either. And a lot of conflict arises, as well as misinformation that wasn't intentional, but it just happens.
Can you request somebody else?
You can try, but when you call 800 numbers for your credit card or something else, if you get somebody that you can't understand, you can ask to be transferred to a United States center, or could I have somebody who speaks fluent English, please? In the hospital, that may not happen, Nursing is an entry-level occupation now for people coming from other countries. They often start as a CNA, move up to LPN or RN. So they've been here several years, but their language ability still may be real difficult for an older person to understand. And they may have a good heart, but the language is difficult.